Hello everyone, this is Kevin Kruse here with Texas Orthopedic Associates in Dallas, Texas. We're a division of Lone Star Orthopedics. Here today talking to you about shoulder surgery and some of the reasons why we use the devices and implants that we use in shoulder surgery. Today we want to talk about the rotator cuff. And the rotator cuff is basically a group of four muscles that become tendons that encapsulate your shoulder. And we have a model of a shoulder here so you can see, what these are. And so if you think of your shoulder in the simplest format, it's really a golf ball and a tee. And the tee is your shoulder blade, which comes into your glenoid. So that's your socket or the tee. And then the ball is your humerus. And the beautiful thing about the shoulder is it has a massive amount of motion, right? So it's got more motion than any joint in the body, but that motion comes at a cost and the joint is prone to becoming unstable. And so the job of the rotator cuff is to keep the ball on the socket, right? It's to keep the ball on the socket. Well, what happens in life, and the analogy I give everyone is your body is like a car, and car parts wear out. And think of your rotator cuff as essentially like the suspension to the car, right? It keeps the car driving down the road. Well, the suspension to the car can wear out sometimes and get tears. And so most people that tear their rotator cuff, they think, oh, I must have done X, Y, or Z. But a lot of this, what we're understanding now is it's genetic. And so people can tear their rotator cuff often just because the tendon wears out over time and it tears, all right? And so when the tendon wears out and it tears, what ends up happening is if you look at this model of a shoulder here, okay, as you elevate your arm, the humerus pinches into the acromion and you get this pinching here. So if the tendons, if the group of rotator cuff muscles, if one of them's torn, you end up getting pinching between your tuberosity and your humerus here, and that's what causes pain. And so, and that pain can be, it can be debilitating for some patients. For some patients, it's relatively mild. And so our goal as surgeons is to figure out a way to get that ball back rolling on the socket very smoothly. And that a lot of times we can treat that with therapy and it can improve your pain because you're strengthening the rest of the cuff that's not torn to help keep the ball in the socket. But there are a subset of patients who fail physical therapy or don't get better with therapy. And then the next step in order to fix your problem is to go in there and repair the tear.